This is a video on the anatomy of the lower limb. The hip bone is made up of 3 individual bones. There's the ilium, the ischium, and the pubis, and each part forms a socket called the acetabulum, and that articulates with the head of the femur to form the hip joint. The ilium itself has an anterior superior iliac spine, which is the origin of the sartorius, the tensor fascial arter, and the inguinal ligament. It also has an iliac crest, which is the origin for the latissimus dorsi muscle. And on the anterior side is the iliac fossa, and that is the origin of the iliacus muscle, which makes up half of the iliopsoas, which is the most dominant hip flexor. The anterior inferior iliac spine is the origin of the rectus femoris muscle, which is one of the quadricep muscles, and that allows flexion at the hip. The posterior surface of the ilium is called the gluteal surface, and this is where the gluteus maximus, medius, and minimus all originate from. And the greater sciatic foramen allows passage of vessels to the gluteal region, and this is formed by the sacrospinous ligament, and the sacrotuberous ligament forms the lesser sciatic foramen. All 3 bones together form the obturator foramen, and this is an area where the obturator nerve passes through to innervate the medial compartment of the thigh, which includes the adductor muscles. The pubis is another bone of the hip, and the part where the pubic bodies meet is called the pubic symphysis, and this is the origin of the adductor longus muscle. And the pubic symphysis allows connection between both sides of the hip, and the inferior pubic rami or ramus is the origin of the gracilis muscle, as well as the origin of the adductor magnus muscle. The ischium has an ischial tuberosity and an ischial spine. The ischial spine is the attachment for the sacrospinous ligament, and that forms the greater sciatic foramen or greater sciatic notch. And the ischial tuberosity is the attachment for the sacrotuberous ligament, and that forms the lesser sciatic notch. The proximal femur has a head which is covered in articular cartilage, and inside the head is a little indentation called the fovea capitis, and that's the origin of the ligamentum teres, which attaches to the hip. And also this articulates with the acetabulum of the hip bone. The greater trochanter of the femur is located laterally, and this is also a site of attachment for muscles, including the gluteus medius, the gluteus minimus, and piriformis muscle. On the front, or the anterior side, is the intertrochanteric line, and this is where some muscles originate and insert into. And on the back, it's called the intertrochanteric crest. And it's called that because it's in between the 2 trochanters, the greater and lesser trochanter. The lesser trochanter is the insertion for the iliopsoas muscle, which is a combination of the psoas major and the iliacus muscle, which allows flexion of the hip. The pectineal line is the insertion for the pectineus muscle, and the gluteal tuberosity is the insertion for the gluteus maximus muscle. And this eventually forms into the linea aspera of the femur, which is also the origin and insertion of muscles, such as the vastus lateralis and vastus medialis originate from here. The vastus lateralis will originate from the lateral lip of the linea aspera, and the vastus medialis will originate from the medial lip of the linea aspera. And also the adductor magnus and adductor longus muscle will insert to the medial lip of the linea aspera. On the distal end of the femur, there are two epicondyles called the medial and lateral epicondyles. This is the medial side, and this is the lateral epicondyle. On the lateral epicondyle originates the LCL, or lateral collateral ligament, and that stabilizes the knee joint and prevents excessive lateral movements of the knee. And on the medial side is the medial epicondyle, where the MCL, or medial collateral ligament, originates, and that prevents excessive medial rotation of the knee. Also at the bottom there's a lateral and medial condyle, and these articulate with the tibial condyles to form the knee joint. And the intercondylar fossa is an area between these two condyles, and these contain facets for the attachment of the ACL and the PCL. On the proximal tibia, which is the shin bone, it has lateral and medial condyles like the femur, and these condyles articulate with the femoral condyles again to form the knee joint. The intercondylar eminence is the area in between the two condyles, and this is the attachment for the ACL and PCL, or anterior cruciate ligament and posterior cruciate ligament. The anterior cruciate ligament is called anterior because it originates on the anterior side of this intercondylar eminence, and the PCL is called posterior because it originates from the posterior side. And the ACL will attach to the lateral condyle of the femur, and the PCL will attach to the medial condyle, and it's called cruciate because of the crossover. The tibial tuberosity is this ridge of bone here, and this is the attachment for the patellar ligament or the quadriceps tendon insertion. So all the quadriceps have a common tendon which attached to this tibial tuberosity. And also the lateral condyle of the tibia has a notch called the fibular notch, and that allows this bone called the fibula, more specifically the fibular head, to attach to this lateral condyle, and this forms the proximal tibiofibular joint. At the distal end of the tibia, there's the medial malleolus, which is this ridge of bone on the medial side. And also on this side is the fibular notch, which allows the attachment of the distal end of the fibula to the tibia, forming the distal tibiofibular joint. And on here there's no fibular notch on this side on the proximal tibia, because the fibular head attaches to the lateral condyle. But on the distal tibia, there is a fibular notch where the distal end of the fibula attaches to. So I got that bit wrong. The medial malleolus, along with the lateral malleolus of the fibula, helps to form a mortise, which is where the talus fits into, and this forms the talocrural joint, or the ankle joint. The fibula has a head which attaches to the lateral condyle of the tibia, and also it's used as a site of attachment for many muscles and ligaments. For example, the biceps femoris muscle inserts here, which is a hamstring muscle, and also the lateral collateral ligament inserts into it. As well as that, it's also an origin for the soleus muscle, which is a plantar flexor, and as well as the fibularis longus, which is responsible for eversion of the ankle, and the extensor digitorum longus, which is responsible for extension of the digits. And at the distal aspect is the lateral malleolus, which is this part down here. And like I said, the medial malleolus of the tibia and the lateral malleolus of the fibula help to form a little groove where the talus can fit into. So the talocrobal joint is formed by the superior aspect of the talus and the tibia and the fibula, all forming this ankle joint. And this allows dorsiflexion and plantarflexion of the foot. Plantarflexion is where the toes point into the ground, and dorsiflexion is where the toes point upwards. And in between the talus and the calcaneus, so the calcaneus is the one in purple and talus is the one in yellow, there's a subtalar joint, which is a plane type joint, allowing inversion and eversion of the foot. The tarsal bones consist of the talus, calcaneus, navicular, cuneiform bones, and the cuboid. The tarsometatarsal joint is in between the tarsals of the foot, so the cuboid and the cuneiforms, and these will articulate with the metatarsals. The metatarsophalangeal joint is a joint between the metatarsals and the proximal phalanges, or proximal phalanx of each digit, and the interphalangeal joint are these joints in between each phalanx. So each digit is labelled from 1 to 5, with 1 being more medially and 5 being the most laterally. And each digit will have a proximal, middle, and distal phalanx, apart from the first digit, which only has a proximal and distal, and therefore it only has one interphalangeal joint between the proximal and distal phalanx, whereas each other digit has 2 interphalangeal joints, one between the proximal and middle phalanx, and one between the middle and distal phalanx.